Hey, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at Petability Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD 22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of MedcoVet, and I'm a proud sponsor of Petability. We decided to partner with Chris and Kathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At MedcoVet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With MedcoVet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them Petability sent you.
Welcome to Petability. I'm your host, Kathy Simons, certified veterinary technician, certified canine rehabilitation practitioner, and certified hospice and palliative care technician for pets.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Good morning, good morning, good morning, Kathy.
Hey, Chris, what's going on over there today?
Well, my little Julep was up twice in the night with diarrhea.
Oh, no.
I know. But you know, the good thing is I am a sound sleeper. And she was persistent and she did not have an accident and she went out right away. So I knew once I woke up that she really had to go. She had a little beach walk yesterday with her brother Baxter. So she may have just ingested a little too much salt water, licking her paws and such. And that may have set her off. Who knows? But she seems fine this morning.
Good. I'm glad to hear that. So, Chris, we've got an excellent show today. I know all of our shows are excellent, but we've really got an excellent show today. We are thrilled to be joined by Mialisa Gluckert from Zomedica. And we are going to be talking to her today about the Assisi Loop, a targeted pulsed electromagnetic field, or commonly heard in the business as tPEMF therapy. Although I have to say that when I was researching this technology, it's not new. It's been used since the 70s, but I have to admit that for me, this is a newer modality, but I've been using it with pretty good success in combination with other modalities and adding to my therapy plans. It was initially researched for the ability to stimulate bone healing, and over time, its applications expanded to include soft tissue repair, pain management, reduction in inflammation, and a variety of conditions. I find that one of the greatest things about it is the ease of its use. It's a portable device that can be placed over the affected area. And so it can be used in the clinic or it can be used at home by the owner. Just before we got on the air, I was telling you guys about how I use the Assisi Loop for a patient who's a little chicken named Goldie. And Goldie was recovering from an egg peritonitis, either an underdeveloped egg or a ruptured egg. The yolk gets deposited in the body cavity versus having normal development. And that can cause discomfort and pain and inflammation. And so Goldie sits on her Assisi Loop, twice a day for 15 minutes. And she thinks it's very special because it's special time with her mom and she's getting this treatment. And I also have two parrots that I use it for the treatment of osteoarthritis. So I think there are so many applications for this device, and it can be used to treat a variety of conditions: the joint pain, postoperative surgery, IVDD, wound healing, and bone healing. So I'm really interested in talking with Mialisa about the science behind Assisi Loop and how it works and how pet professionals are incorporating it into their treatment plans. So let me give you a little background on our guest, Mialisa, before we get started. Mialisa is the Senior Director of Customer Support and Assisi Commercialization. Mialisa is a veterinary technician, so we are kindred spirits, and a former practice manager with greater than 20 years of experience in the companion animal and exotic space. She has her bachelor's in biology with a focus in zoology. She's also participated in research on birds in both the United States and Australia. And after leaving general practice, Mialisa has worked at several veterinary manufacturers, including Verback Animal Health, Royal Canin, and Assisi Animal Health, which has then been acquired by Zomedica. As part of her current role, she educates practitioners on the benefits of Assisi products for their practices and for the pets that they serve. So please welcome to the show, Mialisa Gluckert.
Welcome to Petability, Mialisa.
Thank you so much. I'm happy to be here.
I think we should just jump right in because I'm really excited about this topic, and I'm super excited that you're a bird person. So that's going to come up a lot. Maybe you could start off, Mialisa, by just explaining to the audience, what is the Assisi Loop? How does it work?
So as you stated at the top, it's targeted pulsed electromagnetic field therapy. And what it does is it excites calcium and calmodulin and triggers the nitric oxide cascade. So we're specifically targeting the pain and inflammation receptors in the body. When I'm talking with pet owners about it, I just say, we're specifically targeting the pain and inflammation receptors in the body. So if you've got an itis, this can help you.
I'm wondering, they've been using this technology since 1970s, since the 70s. And I'm wondering, how did they even come up with the thought that this type of targeted therapy would help with bone healing? It's fascinating.
Yeah, and it is interesting. And when we look at research, you go into something with an idea that it might help. And I think along with a lot of other modalities, you come across things by accident. We look at technology for PEMF, and it actually started several hundred years ago. And so it's been interesting modulation and growth, and additional research has been done in both human and animal studies. And so we've seen a lot of benefits of the Assisi products in, like I said, both the human and animal studies.
So Mialisa, if we were to break it down, PEMF, each of those letters represents a word. So pulsed means that for the P in PEMF, pulsed is that it's not a continuous stimulus, if you will. And is it pulsed at a specific frequency that has been proven scientifically to be the best?
Absolutely. Yes, it has. There's a carrier signal that's used that's 27.12 megahertz. And the pulse duration and rate is at 2 milliseconds at 2 hertz. It's not a steady signal. You're getting micro pulses, basically creating a magnetic field that's an electromagnetic signal. So when you think about like how cell phone works, it's similar technology to like a cell phone type signal, but it's doing different things than the cell phone's doing.
I remember back in my PT days when I would talk to folks about ultrasound. We used ultrasound a lot back then. And I said, there's different kinds of sound waves depending on which one is used. Some can take a picture, think about like of a fetus that is growing within a belly, and some produce heat, and some do therapeutic effects without heat. And sometimes ultrasound can be used for cleaning teeth. So there's all kinds of different parameters within I guess it's kind of a physics term. We have light, we have sound, and in this case, it's electromagnetic. So you said it's magnetic. Is the electro converted to magnetism, or how do those two words come together?
Like I said, it's creating a field of energy, and it's an electromagnetic field. So it's not like it's large pulsing magnets. It's creating that field that's an electromagnetic signal. And so when we look at the FDA having cleared the first PEMF bone growth stimulator, it's the waveform specifically used in recalcitrant fracture healing. So there's the BGS and RF PEMF signals produce biological effects, including pain reduction. And the Assisi signal was specifically configured to target normal endogenous anti-inflammatory and repair responses. So it's making our signal more effective because it is that pulsed electromagnetic field.
Can we sort of maybe break down the most common types of conditions that we use the Assisi Loop for?
Absolutely. So probably one of the most common uses we see the loop being used for in the lounge, for that matter, is osteoarthritis. But it can certainly help with any tendinitis, gastroenteritis, pancreatitis, Wobbler's disease, IVD, the intervertebral disease, lots of different uses for this product.
As a rehabber, I'm thinking, of course, joints, joint pains, but the fact that we can use this for like pancreatitis or gastritis, it's a fantastic application.
I was just going to say, and often when, we're kind of at a loss, right? We're doing everything medically to make these pets more comfortable, and to have this as a value add that is, not even particularly perceived. It's so comfortable.
Yeah, I was just thinking in my head too about these animals that get pancreatitis and how painful it can be. And just adding this into your program, adding this into your pain management program for those patients would be fantastic complement to what we're doing to treat the patient.
Yeah, and you make a great point there. And then we also are commonly used in the end of life space, because a lot of times those pets are already maxed out on all the medications they can take. And so this just adds in another layer of care for them. I'm a huge fan of multimodal therapy, and I think that there is a miss in the veterinary space where this could be used more than it is. Pet owners do expect an oral medication or an injection because they like that instant gratification piece. But this is something that pet owners can do at home in conjunction with their veterinarians in the management of whatever pain their pet is having.
You're absolutely right. I have a fair amount of patients who are at the end of their life, and I'm trying to make them as comfortable as I can. And the thing about the Assisi Loop for a lot of these patients at home is, like Chris said, it's not perceived. I can slip it underneath a sheet and have the patient lay down, and slip it under where I need it to go. And it's just, they don't even know it's there. Right.
Right.
So it's comfortable to use.
It's non-invasive, non-pharmacologic, and, easy, as you pointed out, to use. It's a 15-minute treatment. And, a lot of pet owners will sit with their pets while they're doing the treatment. I do want to make a note, though. I always do recommend supervised treatment, because we don't want to add a foreign body to the list of things we care about. We don't want them to chew and then ingest the Loop product.
I have parrots, 2 African grays who use it. And as you know, Mialisa, they love to grab and destroy things. They love to do that. But I think that those birds tolerate it very well because they cover it. The mom covers it with a sheet and they sit there with them. So it's special time. In addition to getting your treatment, they're getting one-on-one time with their owner, which is like, there's nothing better than that. I think it's a bonding opportunity, honestly, for a lot of animals, right? They're calm, they're relaxed, they're getting the treatment, and the people are sitting there with them. And so, there's a lot to be said for that emotional piece of this treatment.
Yes, 100%. And if you combine in with that the pet is feeling better too. So they're having that mental piece where I'm sitting with my owner and I'm feeling better too.
And that's the power of, like therapeutic touch and all of that. And, and I loved earlier, Mialisa, when you said multimodal management. And, that's so particularly true with arthritis. I think the Assisi Loop plays well with others in that it also reminds me of red light therapy. And in particular, the Medcovet Luma, which also works to decrease inflammation, but it's a different way of introducing it using light therapy as opposed to electromagnetic field therapy. Kathy, you and I both use those modalities at home in the comfort of the pet's home simultaneously for an increased effect. And, you guys have been talking about birds.
We love birds, Chris.
I know. But like, what other, species can this be used for? I'm curious in particular about reptiles, because I feel like our reptilian friends are often at a loss again for things that can help them. So, many people have, bearded dragons and iguanas and so forth. Would this work with scaled creatures?
It absolutely does. We have a case study for a green mamba, another case study on a bearded dragon. NOAA, the National Oceanic Atmospheric Administration, they actually did a research paper on sea turtle flipper rehab, and they used the Assisi Loop as part of their protocol there. We are in some raptor centers. We also recently had a zoo purchase a lounge for one of their porcupines. So it really does cover all of our species. We also have a dolphin center using the Loop. And then all of our pocket pets like rabbits and chinchillas and guinea pigs, again, making sure we cover the Loop or the lounge with something so they don't nibble on it. goats have used it, and, our traditional small animal dog and cat friends. And so really, it helps all of those species.
Hi, Petability fans. This is your host, Kathy Simons. Do you live with a blind or visually impaired dog? Don't let vision loss stand in the way of a full, joyful life. In my book, Blind Devotion, Enhancing the Lives of Blind and Visually Impaired Dogs, I share my expertise and passion to help pet owners like you navigate life with a blind dog. From adapting your home to building trust and confidence, this book is your go-to resource for ensuring your furry friend thrives. Your dog's vision may be limited, but their potential isn't. Empower your dog. Get Blind Devotion today at Amazon.com.
When you're talking about sea turtles and dolphins, it made me think of our friend Doug Mader in the exotics world.
Oh, yeah.
He knows about it. Yeah. We interviewed him. He wrote the book on veterinary exotics.
Nice.
I'm thinking as you're talking, that we can cover all species here. And I think about decreasing the stress on some of these smaller animals. Like, it's very difficult to get people to bring their cats in just because it's difficult to get them in the carrier and into the practice. And, historically, cats and rabbits and guinea pigs don't come to the vet as often as your dogs do, simply because it's so stressful for the patient. And so I love that we can utilize this tool at home for those patients and decrease their overall stress level for coming into the office, especially for those rabbits. I mean, in cats, some of them are terrified. So the fact that we can, utilize this in the home is brilliant.
And not only the stress of going into the clinic, but sometimes I think when they're super stressed out, the effectiveness of a given modality may be reduced because their cortisol levels are so high and so forth.
Right.
So when they are in a relaxed environment, it just allows, in my opinion, no scientific research, maybe you can speak to this, Mialisa, but it just allows that being, whatever it is, to accept the modality, the energy and the healing powers behind it.
Yeah, when you look at treatment in veterinary hospitals, we've come a long way since, the 90s when I first started working in a veterinary hospital. And fear-free is a big step that a lot of clinics are taking, sort of the less is more approach. And the nice thing is that we are fear-free certified products too, because you aren't going to increase that cortisol with that pet when you're using our products. Now, if they're in an uncomfortable situation like being in the veterinary hospital, well, then yes, their cortisol is going to be higher. But if they're at home, this is not going to impact us in that way. And with the Loop products, you really don't feel anything. There's no heat that's emitted. There's no sound that comes from it. So the pets, it really is just a non-invasive modality for them.
There are no side effects or contraindications?
There are a couple of contraindications to be aware of. The first one is you don't want to use it in pets or with pet parents that have implanted lead devices like pacemakers or Holter monitors, insulin pumps, Freestyle Libres, because the signal from the loop can actually interfere with the signal of those devices.
Wow.
So ideally, somebody else in the household would treat the pet. Now, the other contraindication we have listed is hemangiosarcomas, because this increases blood flow, and we don't want to do that with the hemangiosarc.
But other types of cancers are okay.
Yeah. So obviously, we haven't done research on every single cancer there is.
There's hundreds out there.
Right, exactly. But there is a study done with the Assisi signal in the human space on post-op breast cancer mastectomy patients, and they were doing reconstructive flap surgery. And they used the human version of the loop in that study. And they showed a decreased opioid usage, decreased clinical pain score, and increase in the speed at which the wounds healed. I feel very comfortable recommending the loop because I'm pretty confident the FDA isn't going to allow you to use a cancer-causing device in known cancer patients.
So, Mialisa, as a layperson, I would think that when I hear the name magnet in any type of modality, that I would think that if I had any metal or my pet had any metal in their body, that it may be contraindicated. But from what I'm hearing, that is not the case.
You are correct to a point. So metal inside the body is fine. Generally, metal inside the body isn't magnetic, but even if it were, all it would do would be to pull the signal into that location. So if you have a patient that has a plate from a TPLO surgery, then that's probably the location of pain and inflammation anyway. So you're going to actually be better off there. Metal outside of the body is where we do run into a problem. So a lot of clinics do have like metal shoreline or mid-mark cages or metal exam tables. Those metal pieces will actually distract the signal from the device and thereby potentially reduce the efficacy of the treatment. So we want to avoid using these products in or around large amounts of metal. If you have a crate that's plastic but has a metal door, we want to make sure that the pet with the treatment field is at least a foot away from that piece of metal.
What about having like a harness or a collar on that may have a metal clasp?
It depends on where you're doing the treatment. So if you're having the patient have treatment around the neck and they have like one of those metal D-rings or a metal collar, I would recommend removing the collar for that treatment. But if they have a metal collar or a D-ring on the collar and you're doing a treatment on the stifle, if they're a foot away, you can leave that collar along.
So a foot seems to be the delineation as far as distance.
Correct.
Got it.
The reason for that is when we look at the Assisi loops, they're creating a treatment field that is within the confines of the coil. And we have two different sizes of loops. We have a 10 centimeter loop and a 20 centimeter loop. The treatment field for the 10 centimeter loop extends to 5 inches to either side of the coil within the confines of the coil. With the 20 centimeter loop, it's 10 inches to either side of the coil within the confines of the coil. And then with the lounge, it's 10 inches from the surface of the lounge.
So it's interesting that you started talking about the coil and the sizes, because I'm not sure, if I never heard of a Assisi loop, that I could even picture what it is. So can you further describe what it looks like and how it's applied in various conditions?
Sure. So what it looks like is a necklace where the chain of the necklace is black rubber that encases the wires. And then the pendant of the necklace is a white battery pack that has a clear view where you can see the lights inside of it. So it's a big circle with a pendant. When we look at applications for use, you really want to make sure that the treatment field, which we just covered, is covering the area on the pet that needs treatment. So if you have, let's say, a pit bull mix that has a partial CCL tear and they're not going to do surgery, but we know that there's pain. If you have them lay on their side and you can place the device in between their knees, then the treatment field is going to extend up and extend down 10 inches. So both of those knees will get treatment because those knees are inside that treatment field that we discussed. Now, the patient does not have to have the device touching them. It can literally be held over top of them. It could be under a blanket. It could be under bedding. You can treat through a cast or a splint, which is really lovely if you have a pet that has a cast or splint on. You don't have to undo everything to be able to do the treatment because it will penetrate through those. The only thing to keep in mind is if you are using bedding, you need to make sure you subtract the thickness of the bedding from the treatment field. So if the bedding is 1 inch thick and you have a loop underneath of it, you need to subtract 1 inch from that treatment field. So if you're using a 20 centimeter loop, your treatment field now will be 9 inches instead of 10 inches.
So when you're talking about the field, the therapeutic field, Mialisa, everything treated needs to be within that circle. It has a 3-dimensionality to it.
Mm-hmm.
Okay, got it. Thank you.
Yes, absolutely.
And Mialisa, we talked about earlier about the loop running a 15-minute cycle, and there really isn't much to be done on the owner's part. Once it's in position, they just push the button and it runs through its cycle. But what are the recommendations for how often? Because I have patients who use it twice a day. I have some patients who use it 3 times a day. And I have one patient who is at the end of their life and who uses it 4 times a day. Mm-hmm. How do we determine that?
Yeah, it's really going to be based more on what it is that you're treating, and is it something that's acute or something that's more chronic? So when we look at something that's more acute, you can treat up to every 2 hours. More is not more. With the loop, you do need to wait 2 hours in between treatments just because there's that battery pack in there. And if you don't wait 2 hours, you'll actually use up all your treatments faster. You get 150 15-minute treatments with the loop. And then with the lounge, you get thousands of treatments, and it doesn't have that 2 hour limitation. But so for the sake of this equation, we're going to talk about the loop. So with acute patients, you can do every 2 hours. When you have something that's more chronic, I recommend starting off initially at, 3 to 4 times a day if they can, and then sort of measure how that patient responds. And you could potentially titrate down to twice a day or even once a day. Now, if you've got somebody that's end of life, they've got a lot of refractory pain, I would recommend sort of playing with the dosing and see, is 4 times a day appropriate, or do they actually need more? But it really will be determined based on what condition you're treating.
Let me ask you this. Can we use it too much? Can it be used too excessively throughout the day? Or
Sure. So there's no real overdosing. You just won't see any net benefit from more than every 2-hour usage.
do the pet parents need a prescription to get the Assisi Loop, Mialisa?
They do not.
They do not. So they could go right to your website, right? And
Yes.
and order. That's great.
Right. We do, however, like to have their veterinary partners involved just because we can't give medical advice to pet parents. And so we really want the veterinarian to be involved so they can talk about the treatment plan and the treatment protocol, frequency of use, et cetera, and then sort of maintain that relationship with their veterinarian and the pet owner.
I have to tell you a little story. I have a friend who's a veterinarian whose dog had corneal ulcers, and she was 16, almost 17 years old. And we both decided, let's use the Assisi Loop for her. And she ran that 4 times a day over her head like a little halo, right? Yeah. And it made a significant impact on her pain level. And she was able to heal from those corneal ulcers. I mean, I don't know if anybody's ever scratched their cornea.
Painful.
But it is a pain that you cannot even describe. So there's so many out of the box things I'm thinking of too. Like I could use this for my patients who have post-op like dental extractions, right? It's just that easy.
Love that you mentioned dentals because we do actually have our dental loop, which is designed for use in oral trauma, dental procedures, things of that nature. And we have an e-collar that's specifically designed for that dental loop to hold the device in place hands-free.
That is so cool. I did not know that. I'm going to have to go to the website. There's a thing that holds it in place.
Yes, buttonholes that are sewn into it. So the battery pack, instead of being in the same plane as the loop, is actually at a 90-degree angle. I do recommend using that one if you've got corneal ulcers. Another sort of quote unquote off-label use that I like is for otitis externa, so those ear infections. You still need to treat the ear infection, but I always think about our little Cocker Spaniel friends who have, persistent refractory ear infections, and then they end up needing to have a total ear canal ablation because the inflammatory process in that ear has just never been stopped. So if we can, reduce some of the inflammation that's happening with those repeat ear offenders, if you will, if we can reduce the inflammation, perhaps we can spare some more ear canals.
Yeah, I love that you guys are mentioning all these things that are more atypical, as you said, Kathy, out of the box to get the folks listening to this episode thinking about how they may implement this device, at home with their pet. So already you've mentioned this Denta Loop and you've mentioned the lounge several times. So what other products are part of this umbrella with Assisi?
Absolutely. Thank you for that question. So we have the flagship product, which are the loops in that 10 centimeter and 20 centimeter size. We have the dental loop that we just briefly covered. And then we also have our loop lounge. I love our loop lounge for our pets that have multiple areas of indication for use. So I always think about, I lovingly refer to them as our coffee table Labradors. Those Labradors that are so obese, you could literally put like a magazine, your cup of coffee, and your remote control on there. They generally have knee problems, hip problems, and back problems. And with the loop, as I mentioned previously, you need to wait 2 hours in between treatments. So to treat that Labrador, you'd need several hours worth of time because of that 2-hour break in between. But with the lounge, which comes in 3 sizes, the entire surface area of the lounge, which is basically like a dog bed, the entire surface area of the lounge is a treatment field. So with that coffee table Labrador, if he lays on his side and all of him fits on the bed, then everything is getting treatment in one 15-minute session within 10 inches of the surface of the lounge. Now, unfortunately, a lot of these guys are more than 10 inches wide, but because there's no limitation in frequency of treatment with the lounge regarding battery life, just have them flip over and hit the other side. and we will get all that dog's body treated in a 30-minute session total. And with the lounge, you get thousands of treatments versus the regular loop, which you get 150, and then the dental loop, you get 60 15-minute treatments.
I want to just expound on that a little bit to make sure I understand correctly. So back to the loop and the waiting of the 2 hours and the battery life. Is it the number of treatments that you're trying to maximize over time, or is it actually not recommended, again, like value add? In other words, let's say I have a dog that has elbow dysplasia and I want to treat that, and they also have a CCL tear in their knee. Could I go with the loop? Could I go from the elbow immediately to the knee, or you have to wait 2 hours because it would actually damage the battery and prohibit all 150 treatments possibly?
Yeah, so if you don't wait the 2 hours with the loop, basically you're going to kill the battery faster. You're not damaging it. You're just using up more energy than it's designed to dispense at one time.
So ultimately, you would not have the longevity of the loop over time.
Yes. With the lounge, though, you want to treat it like you treat your cell phone battery. You don't want to let it completely discharge. You don't want to not charge it for long periods of time. I always use the analogy, you put brand new batteries in the flashlight, and then you don't need the flashlight for a year, and you go to turn it on, and it won't, because the batteries have deep discharged from lack of use. I look at the lounge in the same way. You don't want to have that battery pack left in a really hot car, a really cold car. You don't want to not use it for a period of time. You don't want to overcharge it or undercharge it. So you do need to think about your battery life with the lounge. With the loop, it is just a set battery life. You get a minimum guaranteed of 150 15-minute treatments.
Mialisa, can you give us an idea of the cost for the owner to purchase the Assisi Loop? And does it come with any warranties or guarantees?
Yeah, absolutely. So with the loop, the pet owner cost is $329 from us. With the veterinarians, we do give them that manufactured suggested retail price. And then with the lounges, they range in price depending upon the size of the lounge that's purchased. But the large lounge, for instance, is just about $2,000. But the nice thing is if you have pet insurance, there's a potential that your pet insurance policy could cover the loop or the lounge purchase. It just depends on the policy that you have and any riders that you might have. But there is a potential that your pet insurance policy would cover this.
$329 for 150 treatments breaks down to just a little over $2 a treatment.
With the lounge, it breaks down to like pennies per treatment.
Right.
So, Mialisa, is the price the same for both sizes of loops?
It is the same, just because the technology that is going into it is the same. It's just the treatment field is going to be different. So it's the same strength signal, the same frequency. It's just literally the focal size is different. But yes, they are the exact same price.
And you would base the size that you needed for your patient based on the treatment area or treatment area size.
Yep.
Okay.
But let me ask you this. Then why wouldn't everyone just get the larger one? Because you're treating more areas that could potentially, within a treatment in terms of compensations and things like that. Is there a downside to just getting the large bed or lounger or getting the large loop?
So there are some variabilities in there. I think about like our little teacup Chihuahua friends. If you are looking to treat them with the 20 centimeter loop on their paw, the 20 centimeter loop feels a little bit like overkill. It's going to be a little bit more difficult to place just because of the size of it. With the smaller loop, it's much easier to manage that distal limb. With the lounge, it's more expensive for a teacup Chihuahua for a large lounge that they're only going to use a fraction of that lounge. But if you have multiple pets, we've been sent some pictures of like 3 cats sharing a lounge and they're all sort of stacked up like tacos. And it makes sense if you want to maximize your time with them, getting that treatment all in one go.
Tell me a little bit more about like some feedback you've gotten from customers and particularly our veterinarians that are prescribing these.
Yeah, we've had some wonderful feedback. We've been sent picture after picture of pets doing better. There was a cat on social media. His name was Little Bob. He has osteoarthritis. And he went from not being able to walk to walking to running after having used the loop. We've had,
That's awesome.
yeah, I mean, just great results. And with our veterinarians also sending us pictures, we got a picture at the end of last year about a rabbit that was having some neurologic deficits. And then that rabbit was doing much better after the loop treatments.
Mhm.
You know, being an employee of Zomedica and having access to these products, my one, he's almost 100-pound German Shepherd mix. He gets a lounge treatment every day. He's maintained on 0 NSAIDs, so he's not getting anything like carprofen or Rimadyl or anything like that. He's a 10-year-old, almost 100-pound German Shepherd mix.
Mialisa, did you start using it with him prophylactically then?
I did. So I started using it. So in 2021 is when I started with him on this. So he was 6.
Wow. Good job.
Yeah.
I think that,
Yep.
we know more and more about the pervasiveness of osteoarthritis. And, many times by the time we as pet parents or even the veterinary professionals start to see the signs, it's well progressed. So now we know statistically, how much arthritis is starting at a young age. And I think that if more people can jump on the bandwagon and start doing some of these non-invasive, few side effect, rare contraindication modalities, that it pays for itself, because now you're not paying for, time to the veterinarian and treatments and medications down the road. Plus,
and blood work.
Yeah, blood work, and the cost of those medications, not only financially, but to our pets' bodies, liver, kidneys. So I think that Assisi Loop provides a lot of instruction, I think, in the packaging, as well as there's online support and such for pet parents to be able to use this with confidence in terms of, some of our questions, placement and how often and so forth.
Yeah, so there are instructions, but like I mentioned earlier, we do want to make sure our veterinary partners are included in the treatment, just so we can make sure that the modality is being used appropriately. But yes, there are instructions. It talks about the treatment field. It talks about the contraindications, all on the packaging.
Are there any misconceptions about this technology, or specifically the Assisi Loop, that you would like to dispel?
So it's not so much a misconception. It's about skepticism. Because you can't see anything, you can't feel anything, there's no heat emitted. It's really a misunderstanding of how the product works. And to some degree, it sort of feels like snake oil. It's sort of too good to be true. But we have a lot of data to back up our products. So there are studies coming out of veterinary schools, out of veterinary practices, other academic studies. So there's a lot of data in both the human and animal space to support the efficacy of the Assisi products.
I love that transparency, because calling it right out, I think, is wonderful. Because you're exactly right. In the minds of a lot of folks, whether professional or lay people, they're going to say, well, as you said, this is too good to be true. And typically, when you think something is too good to be true, it is. And
Usually is.
yeah. But there is scientific proof, behind this. And so, sometimes we just have to go on, blind faith, and know that the companies behind these products have done their due diligence and done the research. And like you said, all the case studies and testimonials and things that speak to it as well. Right. I think Kathy asked you about warranty. Did you say, is there any warranty on
Sorry,
either?
I forgot to mention that.
Okay.
The Loop comes with a 90-day warranty, and the Lounge comes with a 2-year warranty.
Oh, that's good. Lounge, 2 years.
And you get from most electronics you purchase from a store.
Nice. I was thinking, as you guys were talking about the scientific data behind this technology, it's great. And we love that, especially as scientists. We love to see that there are papers and studies and peer-reviewed, papers. But the proof for me is when I see my patients engaging in things that they haven't done in a long time, and engaging in things like going for, walks, or in Goldie's case, getting better and laying another egg, or just engaging in the things that bring them joy and what makes their life, pleasurable. There's no greater feeling to see that, the dog climbed the stairs, the dog got in the bed, or the dog went for a walk, or the cat played with their toy, or the bird that I use it on is starting to climb around in her cage. This is all to restore for them normalcy and a good quality of life. We've managed their pain, and that contributes to overall quality of life.
You are 100% correct on that. There's a study out there, and I can't remember the exact numbers, but it's something along the lines of like 74% of cats over the age of 10 have some degree of osteoarthritis. And most pet owners don't recognize that as pain. They recognize it of, hey, my cat's not jumping up on the kitchen counter anymore. Isn't this great? Or my cat, is staying off the dining room table. But there are some other sinister signs that you might see where the cat is urinating outside of the litter box, or is spraying more, or, won't do some of the play activities that they used to do. And all of those can be signs of pain. And if we can help manage that pain, then they feel better, you feel better, and that human-animal bond is really reinforced.
And I always like to remind people, because you started this talk today saying that the Assisi Loop addresses, or in general, the tPEMF technology addresses inflammation, anything with an itis. But one of the signs of inflammation is pain. And I think for a pet parent, that's really what we want most of all, is to reduce that pain. Another sign is diminished mobility or loss of function. For our animals, that's how it manifests is, maybe not engaging, not moving, not being participatory in the family's lives. And so I'm glad you brought up those examples about the cat. I think that was well said.
And the fact that that pain itself can erode at the human animal bond.
Mm-hmm.
I mean, most importantly, our patients, we don't want them to be in pain, but it really does break that down as well. Mm-hmm. So thank you, Mialisa. This was great. Mialisa, as we're wrapping up, do you have any last thoughts you'd like to leave the audience with, a pearl of wisdom that you'd like to share?
Absolutely. When we are looking at managing pain and inflammation, I really do, as I mentioned earlier, prefer multimodal therapy, because we know that pain can be really, really erosive to that human-animal bond and how that pet feels. And so if your veterinarian has only prescribed one thing, ask them, is there anything else I can do at home? Hey, I heard about the Assisi product. Do you have an objection if I add this in? We want to be advocates for our pets, and for our veterinary friends that are listening, think outside the box sometimes. This can be a great modality to add in for patients that do have conditions like chronic kidney disease that would prevent you from using traditional medications. And this can work in harmony with those traditional medications too.
I think that oftentimes, veterinarians are so overworked, so tired, and just, burning the candle at both ends. And so, we get it, we empathize. But many of these things, these technologies, and the use of adoption comes from pet parents advocating. And, that even speaks for me. I came from the human physical therapy field and pivoted to small animal rehabilitation. And over 20 years ago, when this was just being formalized, it was the parents, the owners of these pets that started asking the surgeons and asking their veterinarians. I went to physical therapy after, I had my knee surgery. Is there something I can do for my dog after their cruciate repair? I think also that people are craving more options that are non-invasive, so again, red light therapy, PEMF, it's founded in science. So I really love that last thought, Mialisa.
Thank you.
Mialisa, where can people purchase the Assisi Loop? Where can they go to find it?
Yeah, so they can go to their veterinary partner and purchase from them, or they can buy direct from us at assisi.zomedica.com.
And there's all kinds of things on your website there too, right? There's stuff for pet parents, there's stuff for veterinarians to look at.
Correct. And we do also have webinars for our veterinary friends, and webinars, we call them Webbies, for our pet parents, so they can learn about things, a lot of research, information about the products, frequently asked questions.
Mialisa, you've mentioned a couple times veterinary partner. So I'm assuming not all veterinarians are partners. Is this like an affiliate type program where they receive extra training? Is there a place to learn about where these vets may be, or the pet parent ask any veterinarian, and then they have the ability to prescribe the Assisi Loop.
Yeah, the vet, it's the last one. The pet parent can ask their veterinarian, and their veterinarian can get the product very easily from either their distributor partners or from us.
This has been very enlightening. I'm so glad you joined us here today. And I hope that our listeners are really going to get some benefit from this show. And I hope they check out the Assisi Loop, because I think it's a fantastic modality to, like you said, add to or complement to our patients' therapy plans or their end of life plan or their tooth extraction or whatever you have there. So thank you for being here today.
Thank you so much for including me in this. I really enjoyed spending this time with you and sharing about the products and how we can help our pet friends.
Thank you.
Yes. And I just wanted to say, until I started doing some research about the Assisi Loop, that was the first time I knew about the expansion of products to the lounge, to the dental loop, we didn't mention the Calmer Canine Anxiety Treatment System.
That might be a different show.
Need any help with Calmer Canine, let me know. I'm happy to help with that.
Okay. Well, you bet. We will be in touch. But Mialisa, thank you so much for lending your time and expertise. It was a pleasure to meet you.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at Petability Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you, and tune in next time.